Hi, my name's Anna Middleton, and I am a genetic counsellor. I've been a genetic counsellor since 1995. And my task for today was to talk to you about genetic counselling in the future. What are the challenges and what are the existing opportunities? And well, what gives me the, I suppose, eligibility to be able to talk to you about this? Well, I've been previous chair of the Association of Genetic Nurses and Counsellors in the UK and Republic of Ireland. So that's, for those of you who are based in the UK, that's the professional body that represents us as genetic counsellors. And that's given me a wonderful insider knowledge to how genetic counselling fits within clinical services and strategy from NHS England, particularly in government strategy, and how we as a profession can help to shape the policy around this. And then I've also been previous vice chair of the Genetic Counsellor Registration Board, which is the organisation that oversees the regulation and registration of British genetic counsellors. And as part of my previous role, I was involved in writing the first set of reciprocity guidelines and policy for the GCRB. So that was where we were looking at the certification and qualifications and competency to practice of genetic counsellors who are trained outside the UK, and how their roles, profiles and competency could translate to the British system, and what would be the recommendations in terms of reciprocity. But I'm currently a head of society and ethics research at Wellcome Connecting Science. So I'm actually a full-time research genetic counsellor. My clinical practice has been non-existent for a little while now. So I worked clinically as a genetic counsellor in both Leeds and Cambridge, and then have worked in a research setting in Cardiff, and then most recently at the Sanger Institute or Wellcome Connecting Science in Cambridge. But my sort of eclectic history as a genetic counsellor, both in clinical practice and also in research and in policy, has given me incredible access over the years to the international genetic counselling community. So I'm thinking of meetings that have happened with the Transnational Alliance of Genetic Counsellors, with various sort of board meetings between different genetic counselling boards over the years, conversations with genetic counsellors from India as they are developing their practice there, conversations with Australia and the board there. So over the years, I feel like I've had quite a privileged position to observe and see how the genetic counselling profession is developing around the world. And there are only 7,000 genetic counsellors across the world. We're a really, really small profession, and there's lots of scope to support each other and evolve our practice together. Okay, so in thinking about what are the challenges, so I've, try and forward my slide, hang on a second. There we go. Over the years, I'll talk from the British context, but this is translatable to many other international contexts around the world. We have spent collectively as a profession a very long time, 20, 30 years, establishing the profession as a standalone profession. So our forefathers, or I suppose grandmothers originally, who developed the profession where it came out of nursing, started the ball rolling really of us genetic nurse counsellors allied to clinical geneticists. And the role started off as quite a support role where we would do pre-clinic work for the medics. We would have letters signed off by the medics, and would be a real support role to them. And over the last 20, 30 years, there's been such a collective movement away from that model, where genetic counsellors are now pretty much uncoupled from having to answer to and have work signed off by clinical geneticist colleagues. And part of that uncoupling has been, well, inevitable in the way other professions have uncoupled. Like physiotherapists, occupational therapists, speech therapists don't have to answer to medics for their own practice. just as genetic counsellors don't have to now. But part of the infrastructure that has enabled that has been through the development of registration and regulation. And so that has given the framework around the practice of genetic counselling and the support to say, look, we answer to our regulator and to the very clear competencies that are internationally agreed, and you need policy people and strategic people to be writing these. So where we establish the skills of what genetic counselling is. So over the last 20 years or so, genetic counsellors have, select genetic counsellors have taken a strategic position and have pushed the profession forward and then passed on those messages to the next generation. And we've built and built and built, largely through the AGNC, actually, in the UK setting, where policy's been written, where meetings have been attended, where high-level strategic discussions have happened around what is the role of the genetic counsellors and what can genetic counsellors do. And as all that building has happened, the profession has become more established and standalone. Historically, we all know the difficulties about misunderstanding of the word counselling in our title. And it always makes me smile a little when I see new graduates out of master's programmes who might say, why are we called genetic counsellors? That's a problem. Has nobody ever realised that this is a problem for us? Yes, we've realised this is a problem for us for many years. And the word counselling came from the American description of counselling, which is about information giving and shaping and advice and supporting from that educational angle. And the translation of that into more psychotherapeutic models is something that different countries have embraced in different ways. So for counselling skills, that's something that we celebrate and enhance within the genetic counselling profession in the UK, and also similar models in Australia, and more American-based models in other countries around the world. So it's used in slightly different ways. But we don't have a great alternative, and lots of alternatives have been tried. And we also have an established literature now around genetic counselling. And I know in the latest discussions about the new Genomic Medicine Service, questions were asked about whether the name should be changed at that point. So that was back in 2017. And we felt that as the term is internationally recognised now, that we should stick with it. As genetic counselling as a profession has evolved in different countries around the world, it's guided by the health setting where health services are delivered. So in some countries, that's based on a not-for-profit, government-funded health service. So like we have in the UK within the NHS. And in other places, it might be within the for-profit industry. So genetic counselling is offered as part of companies and privately funded health services. So that's obviously going to have different drivers and pushes and pulleys, in terms of how it's delivered and moulded, depending on the setting. And also the starting point for how genetic counselling has emerged in different countries varies. So in some places it has evolved out of paediatric services. In others, it's more aligned to fetal medicine, prenatal services or cancer. And also in some countries, it's been born out of public health screening and community, carrier screening. And, we as a global, group of genetic counsellors need to sort of welcome the diverse cultural settings where genetic counsellors are working, and not see that there's just one model of genetic counselling, that there's one sort of westernised style of what genetic counselling should be. If it's one thing I've learned is that, in other countries outside of the UK that are setting up their own culturally appropriate genetic counselling services, they may look quite different from how we do genetic counselling. And I would say, welcome all. We're such a small profession, there's enough room for lots of different models of service delivery. And then thinking about existing opportunities, when we think about genetic counselling, we often think about clinical practice and patients. And if there's one single message that I'd like to get out in this presentation, it's an acceptance and a recognition that there are lots of genetic counsellors now working outside of that classic model. And again, you know, in a sort of welcoming and appreciative stance, it's good to recognise that we're all contributing to the same goal, you know, even if we're not working directly in a clinical setting, which is to do good for patients. And particularly in the UK at the moment, things are incredibly exciting for the clinically practicing genetic counsellors, as we have the development of the new Genomic Medicine Service Alliance. And as part of the AGNC, only recently we signed off the most recent career structure document, which has the bands 8D and 9 positions in there, which are for for GMSA, so Alliance Genetic Counsellor Leads. So these are really, really senior positions that are separate from the clinical service management, and they're focused on strategy, with a vision to implement genomics across mainstream medicine. And it's so fabulous that within that mainstreaming agenda, genetic counsellors have a seat at that table. And the reason they do is because of years and years of networking, soft networking, conversations, prompting, particularly on behalf of the AGNC and all of the different members of the AGNC committee over the years, making sure that genetic counsellors are on the agenda and their voices are heard and people know that the profession exists. So within clinical services, there's now these amazing opportunities for really, really senior roles that are based on looking at the strategy of health services moving forward and the place of genetic counselling within that. So then I wanted to just talk very briefly about the research leaders within genetic counselling. So I'm myself as a genetic counsellor, I run a research group when we have 3 research genetic counsellors in it and a group of social scientists as well. And I would really strongly advocate for genetic counsellors doing their own research. So when I started out in research, my PhD was in genetics and psychology. So at that moment in time, there wasn't such a thing as a PhD in genetic counselling. But now there are programmes that are starting to emerge, particularly in Canada and Australia, where you can do a PhD in genetic counselling. And that's absolutely fantastic. We need the researchers to be exploring the evidence base behind what genetic counselling practice is and what it does. We have to have evidence-based medicine. And I think it's unfair to expect clinically practicing genetic counsellors to lead on research. You know, they're busy enough. And, you know, there's space for genetic counsellors to lead in this area and to really provide the evidence that can underpin practice. So how do we measure that what we do works for patients? What are the metrics behind it? How do we evaluate success? How do we evolve the communication models? How do we bring in new technology and find the evidence base behind what works and what doesn't work? We need that research to underpin it. And who best to do that than genetic counsellors themselves? Because if we don't do that, then it will be psychologists, social scientists, people who've never worked in practice who will be doing the research on our processes. And so I would really, you know, celebrate and support the research leaders who are doing their best to support clinically practicing genetic counsellors through research. The other thing that I've noticed as a research genetic counsellor is that it's opened certain doors for me that have been, I know that if I was in clinical practice still, I wouldn't have had those opportunities. So as a researcher, you get access to sometimes very high level meetings about strategy, about the future direction of medicine, about government initiatives, and you get access to committees and networks that you wouldn't have access to as a clinically practicing genetic counsellor on the ground. So, for example, you know, Matt Hancock, our health secretary, came to the Sanger Institute where I am a little while ago. It was before the pandemic, and I got an opportunity to ask him, what's your vision for the future of genetic counsellors? And of course, he hadn't really heard of them, and so I was able to explain what it is that we do, and the place within the genomic medicine service. Now, I know if I'd been in clinical practice, it would have been more difficult to have that direct conversation, but there is something about the research arena that means you have this kind of, I guess, access to these incredible networks. So I wouldn't underestimate the contribution that researchers can make in this space. And then I'm thinking about other incredible genetic counsellors actually who are working in different arenas. So if we think about policy, so Genomics England, for example, had the foresight to employ a genetic counsellor lead to help write the policy that would determine consent processes, for example, or how data is coded or shared, or to influence the bioinformatic pipeline coding around the return of results, or the policy around additional looked for findings. So, it's genetic counsellors are in these policy strategic roles now, and that's clearly fantastic to have a voice on the inside in those sorts of big things that affect clinical practice. And then, of course, education. We have, clearly lots of incredible masters training programs that train the next generation of genetic counsellors. And I do remember when the Genetic Counsellor Registration Board was writing their policy on the accreditation of various different masters courses. And one of the pieces that went into that was a requirement that course directors included genetic counsellors. And that might seem a sort of obvious thing to say, but we're very, very aware that there are quite a few genetic counselling courses that have been set up around the world by people who aren't genetic counsellors and have never practiced as genetic counsellors, but think they know what genetic counselling is. And it's a bit sort of like me saying, I fancy setting up a course in radiography. Can't be that hard. I'm sure we could do it. It's that sort of thing. And I feel very passionately about, there's enough genetic counsellors who are highly skilled, who are, fully competent in being able to train and teach the next generation. And so we should require the utmost standards, in requiring that our trainers and our teachers at least understand what genetic counselling is and have training in it to be able to teach it. And then other areas where genetic counsellors have excelled is in training in terms of systems training. So I'm thinking particularly about Health Education England and the embracing of upskilling of the NHS workforce in genomics. And we've been so fortunate to have a key genetic counsellor on the inside there. So when, for example, the curriculum was being written for the scientific training programme, the STP programme, that genetic counsellor was absolutely pivotal in reaching out to the genetic counselling community and saying, come on, let's get together to write this curriculum. If they hadn't been in post, then it would have been, it would have been a clinical scientist who would have written that curriculum, possibly. But it's fantastic to have, again, people on the inside of the strategy for training. And then, of course, there are incredible genetic counsellors who've crossed over into industry. So not only working for other companies, supporting with their genetic counselling, but also setting up those companies. And I think it's wonderful when you see genetic counsellors on the board of directors of companies and have a stake in company profits, a sort of stake of the pie, and are really innovative and are pushing the boundaries of what's acceptable in industry, and exploring innovative techniques and engagement strategies like using chatbots, trying to reach the masses with information about genetics. I've put in Colour as one of the companies that employs genetic counsellors, and also Congenica. So that's Congenica is a British company that looks after bioinformatic pipelines for Genomics England and sequencing in the UK. And they approached me to do some consultancy work for them, which actually I haven't done yet, but they particularly wanted a genetic counsellor voice to be able to call upon for counselling type issues that they were having to engage with when they were, selling their pipelines to healthcare practitioners and helping the healthcare practitioners know how to communicate results to patients. So that's industry. And of course, private practice is really flourishing as well. So there are certain countries where there haven't been enough jobs in the, the government-funded healthcare setting. And so there are genetic counsellors around who've been shown a lot of initiative and just set up their own private practice and have filled a gap in the market and doing incredibly well. And then, of course, there are also really senior genetic counsellors out there, and I'm thinking particularly of Australia, who negotiate with government and manage government funding to support genomics alliance initiatives across the whole country. And again, having a genetic counsellor voice at such a high level can frame a whole national initiative so that it's, from a genetic counselling position. So it's patient focused, it's listening, it's reflective. It's not just based around testing, it's based around the patient experience, the pickup, the fallout from testing, the support of families. And so, there's so much more to genetic counselling than the clinical experience. And I would say that all of us who are working outside a very traditional role have something to offer to the traditional role, because we're all doing our sort of little pieces of the jigsaw to support, to underpin, to provide evidence, to write strategy, to push on policy, to help get the patient agenda into the thinking, into the training, into the strategic decision making, into industry. All of this is about improving things for patients. I should also mention, which I haven't got on the slide here, is the charity sector as well, and the support groups. So there's a role there. Quite a few support groups now have genetic counsellors on the staff to help write patient-facing material, to help explain what genetics is and the terms and the conditions to a lay audience, and to help do some of the bridging between clinical services and potential patients who haven't yet reached those services, and also to do some of the support post-clinic consultation as well. So yeah, there's quite a need really for that sort of joining up with the patient organisations and the clinical services, and genetic counsellors have bridged that gap. Okay, so there's some of the existing opportunities around the world. It's an incredibly exciting time to be a genetic counsellor. There are only 7,000 of us worldwide, and we kind of need to recognise the value that we all put into contributing to our profession from many different angles. And of course, as genomics is moving away from very specialist clinical genetic services across into mainstream services, so into cancer, into prenatal, into heart disease clinics, across the whole of medicine, the roles for genetic counsellors will just increase. And so it's a very exciting time to stay registered, keep in touch with our professional bodies, and collectively network and stick together. So just to finish, I wanted to say it's a very exciting time to be a genetic counsellor. We have many transferable skills. It seems really obvious, but the basic training in how to communicate, how to reflect and think about what somebody else is saying, how to listen, and how to walk for a moment in someone else's shoes, so valuable in life, whether that's negotiating with colleagues, whether that's being persuasive of fundraisers, funders, whether that's persuading governments that investment is needed, whether that's writing policy or curricula or writing learning outcomes. All of those listening and communication skills are really, really valuable. So I'd say for anybody who wants to work in this space, it's a very exciting time. And for those of us who are in this space, again, it's a very exciting time, and there's lots of opportunities moving forward. Okay, thank you.